What is a country about? The military, the economy, or is it the technology? A country is about the people.
Governor Romney, you wanted repealed. You want the Affordable Care Act repealed. Why?
I sure do. Well, in part, it comes again from my experience. I was in New Hampshire. A woman came to me and she said, look, I can't afford insurance for myself or my son. I met a couple in Appleton, Wisconsin, and they said, we're thinking of dropping our insurance. We can't afford it. And the number of small businesses I've gone to that are saying they're dropping insurance because they can't afford it, the cost of health care is just prohibitive. It puts in place an unelected board that's going to tell people ultimately what kind of treatments they can have. I don't like that idea.
It wasn't just that small businesses were seeing costs skyrocket and they couldn't get affordable coverage even if they wanted to provide it to their employees. It wasn't just that this was the biggest driver of our federal deficit, our overall health care costs, but it was families who were worried about going bankrupt if they got sick. Millions of families all across the country. If they had a pre-existing condition, they might not be able to get coverage at all. If they did have coverage, insurance companies might impose an arbitrary limit. And so as a consequence, they're paying their premiums. Somebody gets really sick. Lo and behold, they don't have enough money to pay the bills because the insurance companies say that they've hit the limit.
In the recent years, America has been trying to enforce the idea of public health coverage to all its citizens, thus causing conflicts and debate arise among the people.
Nothing in this plan will require you or your employer to change the coverage of the doctor you have. Under this plan, it will be against the law for insurance companies to deny you coverage because of a pre-existing condition. As soon as I sign this bill, it will be against the law for insurance companies to drop your coverage when you get sick or water it down when you need it the most. They will no longer be able to place some arbitrary cap on the amount of coverage you can receive in a given year or in a lifetime. We will place a limit on how much you can be charged for out-of-pocket expenses because in the United States of America, no one should go broke because they get sick. And insurance companies will be required to cover, with no extra charge, routine checkups and preventive care for those Americans who can't get insurance today because they have pre-existing medical conditions. We will immediately offer low-cost coverage that will protect you against financial ruin if you become seriously ill.
The difference between public and private, is there a big difference?
I would say no, because the health center that I worked at, they had specialists in their field, like very highly specialized, and I mean experts. They did a great job, and all patients were welcome to come to this facility. So I would say the care that, from my experience, that they were able to receive was equal to what someone paying privately could go to a clinic or a nicer hospital to receive.
Do you think that would be the only reason that people don't want all public?
Oh no, I mean besides the cost, I think Americans love independence and the ability to choose their provider, when they see someone, where they see someone. Americans love, they are fiercely independent, and so I mean that's a huge difference politically, even between, or politically and an individual difference between Canadians and Americans.
So we can assume that this is a major cultural problem.
I think so.
With the current Obamacare, we can see that in more than one way, the citizens under the system has been restricted.
This bill does not control costs. This bill does not reduce deficits. Instead, this bill adds a new health care entitlement at a time when we have no idea how to pay for the entitlements we already have. We don't think the government should be in control of all of this. We want people to be in control. And that, at the end of the day, is the big difference. Now, we've offered lots of ideas all last year, all this year, because we agree that status quo is unsustainable. It's got to get fixed.
Dear Mr. President, in a time as now, when the economy suffers and the people stir, what should America do?
Let us take a closer look at another country, Austria, who has one of the leading healthcare in the world.
Austria spends some 10.1% of GDP on healthcare, compared to 16% of GDP in the United States. Austria boasts of cutting bureaucracy by the use of a high-tech e-card with electronic signature and personal data for proof of medical insurance, eliminating paperwork. Almost the entire Austrian population is covered by social health insurance. About a third of Austrians also take out private health coverage to pay for what is called a special class of hospital room, or to pay for doctors not affiliated with the state-affiliated hospitals or the state insurance fund. Private hospitals are not obliged to admit patients and can pick and choose depending on the patient's ability to pay and the quality of private health insurance. So while Austria has universal health care, the ability to pay more for special doctors and treatment and hospital basically sets up a two-tiered system in terms of the level of care available to people. Lou?
You can call it two-tier, or you can say there are two classes of Austrians.
That's exactly right. They use the term special class, actually, for the private hospitals.
The majority of the people is satisfied with their public health system. They have an e-card system that stores all their data, which is used nationwide.
Both candidates saying, both Governor Romney and President Obama, they're both saying, I'm the one who's going to save Medicare, and the other guy is going to end it. Either Romney saying that Obama's going to do it through cuts, or Obama saying that if Romney adopts this premium support plan, that's going to bring about the end of Medicare. So they're both trying to make the exact same message to voters. Instead of having Medicare as we do it now, seniors would get a check from the government with which to buy insurance. Most of those insurance plans would be private insurance plans. They say now they would also have one traditional Medicare choice that the government would run. So you'd have a bunch of private plans, one government plan you could choose from. The government would give you a set amount of money with which to purchase those plans, and that's how you'd have choice, you'd have competition. That's their idea. But right now, we're under what's known as the fee-for-service program. You hear that a lot. What it really means is that doctors and providers are reimbursed for Medicare per the number of services that they perform. And critics of fee-for-service don't like it because they say all it does is reward providers for doing more services. That leads to unnecessary care. That leads to doctors seeing you super quickly and moving you out so they can see as many patients as possible so they can get reimbursed as much as they can, maybe because they need to just to, stay afloat. So it doesn't really reward quality of care. It doesn't reward physicians spending more time with their patients. And it's generally agreed that this is not the ideal way to pay providers, and we want to change it.
Many changes will have to be made by the government. Will the government be able to enforce it thoroughly or end up bringing the whole system down?
Now, Mr. President, isn't it about time to take action to bring our nation back alive, starting from the people, so that you grant them a healthy body to contribute to the country? We need to change healthcare. If not now, then when?